Member Calgary Fish Creek, followed by Calgary Bow.
Thank you, Mr. Speaker. The Misericordia Community Hospital in Edmonton is in dire shape. Leaky pipes, downed elevators, and an intensive care unit that is only available based on the weather. When it rains, the place leaks and services shut down, patients lie on stretchers and gurneys in the halls, and even renovated bathrooms are not equipped to be barrier-free. Mr. Speaker, the Health Minister acknowledges that the MIS needs to be replaced. In last week's budget, nothing was presented in the capital plan to fix the Misericordia. My question is to the Minister of Infrastructure. Why isn't it on the list?
Honourable Minister of Infrastructure or Health.
Thank you very much, Mr. Speaker. Well, I'm glad the honourable member is raising this again because it gives me another opportunity to tell the honourable member and all Albertans that we are committed to working with the Misericordia, with Covenant Health, to complete critical infrastructure repairs. There is currently over $19 million that has been allocated for these repairs, Mr. Speaker. About $6.2 million has already been spent on things like upgrades to elevators and the electrical system. Mr. Speaker, we've asked Covenant Health for their estimate of what other funding will be needed over the next 3 to 5 years for this purpose.
First supplemental, honourable member.
Thank you, Minister. Given that the MIS was slated for a rebuild or replacement 6 years ago, and given that in 2010 AHS had $100.1 million approved budget for the MIS, but placed the project on hold, can the Minister of Infrastructure explain why the project was deferred, and where is that money now?
Honourable Minister of Infrastructure.
Well, Mr. Speaker, I find it interesting that the member opposite is against us getting the best value for the infrastructure that exists in Alberta, Mr. Speaker. I'm a little perplexed also. They don't seem to like the fact that we're spending $19 million to keep it going and keep it in a good, safe condition for patients in Albertans so that we can continue to get the very best value for Albertans, Mr. Speaker. On one hand, they say don't spend so much money. On the next hand, it's a spending day. It's a spending day. It's a spending day. Mr. Speaker, when they decide what they do want, we'd be happy to hear about it.
Final supplemental, honourable member.
Thank you, Mr. Speaker. Minister, it's about patient safety. That was brought up 6 years ago. Given that the MIS is now AHS' second most important new project, and given that the costs have increased since the minister pulled the $100 million in approved funding, will the minister enlighten us on what the new costs are now to replace the MIS?
Honourable Minister of Health.
Well, Mr. Speaker, first of all, let's be clear. Alberta Health Services has made a number of high-priority recommendations for renovation and replacement of aging hospitals in this province. The Misericordia is one of those hospitals. But, Mr. Speaker, what the honourable member doesn't do, of course, today as part of her question is talk about the $1.3 billion that was spent to build the South Half Campus facility in Calgary. As I've said, Mr. Speaker, we are working together as ministries to determine the ongoing hospital capital infrastructure needs for Edmonton and the capital region, and a decision about a new facility.